As millions of Medicare beneficiaries head into this year's annual enrollment period, which runs from October 15th to December 7th, there are major disruptions occurring in the Medicare Advantage market. This all pertains to Medicare Advantage. If you have a Medicare supplement with any company, that is not going to change. This is exclusively directed at Medicare Advantage members. The first thing you'll want to pay attention to this year is check your mail for your annual notice of change. This letter will detail any changes to your current plan benefits, such as copays, coinsurance, or premium differences, if that plan will renew for 2025. But more importantly, check your mail for a notification that your Medicare Advantage plan will not be renewing. This is different than the annual notice of change that simply tells you about minor benefit tweaks for the new year. A non-renewal notice means that whatever plan you have in 2024, once 2024 ends and we hit January 1st, that Medicare Advantage plan may not automatically renew like you've experienced in previous years. Hi, my name is Mark Pripp, and I've been helping people understand the Medicare landscape, plans, and enrollment periods for over 15 years. Big companies like Aetna, Cigna, Humana, and Centene, to name a few, may be reducing benefits for the 2025 year, but more importantly, have come out publicly stating that they will not be renewing thousands of plans throughout the United States. So again, check for those notifications to see if you are one of the individuals that will be affected by this plan terminations. Do not automatically assume that your plan will just renew into the new year like it has in the past. So why is 2025 going to be so much different than past years? Well, I believe it comes down to two things. If you look at a lot of the news headlines, there's big talk about big disputes between Medicare Advantage companies and hospitals and medical providers not agreeing on reimbursement rates. And then you also have the medical loss ratio that insurance companies have to work with, coupled with a lower reimbursement rate from the federal government. So it's almost like the perfect storm is happening where these companies are saying the money that we're being reimbursed from the federal government for the 2025 calendar year is not enough to match the amount of money that we're paying out in claims. So what these big companies are doing, they're looking at all of the lower performing areas in the country to determine which plans are not profitable. Unfortunately, that's just the reality of it. The information I'll share with you in this video, I will provide resource links in the description below so you can read the entire articles. I'm simply going to just show you some snippets from each company just so you can be aware for these notifications. So who will be affected by this change? This change is going to occur across many different states, but generally speaking, your larger states like Florida, Texas, and California could be the ones that experience the biggest impact because they have the highest enrollment. It's rumored that over 100,000 people just in Florida alone will not have a plan renew automatically for the 2025 year. Let's take a look at some of these news articles and actual screenshots I took from the home pages of some of these insurance company websites. Let's start with Aetna. Aetna now covers 4.3 million people through Medicare Advantage plan. 2025 changes could cut Medicare enrollment by 10%. And the CFO, Mr. Cowie, said that's a good baseline. Moving on to Humana. If you've been on a Medicare Advantage plan during 2024, that plan might not be offered in 2025. Humana is dropping out of 13 Medicare Advantage markets next year. So more than 550,000 people, or roughly 10% of its participants, will lose their plan. That's an article taken from Morningstar.com that I linked in the description below. And here's a couple screenshots I took. I went directly to Premera Blue Cross Blue Shield of Washington State. Premera Blue Cross has publicly announced the company will exit Medicare Advantage plan. That's a big one. I believe that was roughly 30 or 40,000 people total that will have no Medicare Advantage options with Premera in the state of Washington. Same exact problem with Blue Cross Blue Shield of Kansas City. Kansas City is exiting the Medicare Advantage market at the end end of 2024. We still have Medicare options to choose from. Explore our Medicare supplement plans to see if there's a plan that meets your needs and budget. Centene, another one that is dropping almost 40,000 people across several states. Let's take a look. For Centene, Medicare Advantage members will need to find new plans come 2025 in the states of Alabama, Massachusetts, New Hampshire, Rhode Island, New Mexico, and Vermont. Roughly 37,000 Medicare Advantage members will be impacted by the market exit. Vermont is especially vulnerable as Centene previously had control of 9% of the market. So I believe what they're saying is the biggest disruption with Centene is going to be in the state of Vermont. Here are a few tips and recommendations of what you can do if you do receive a notification that your plan is not renewing. Tip number 1, open your mail promptly. I know that we all get a lot of junk mail day in and day out. Highly recommend do not throw anything away that has to do with your insurance company, Medicare, or the Social Security Administration. These letters will confirm changes or terminations of your current Medicare Advantage plan. Tip number 2, if you receive a letter that your plan is not renewing, do not panic, but also don't wait. Use resources like Medicare.gov or contact a trusted advisor like myself to compare the different Medicare Advantage or Medicare supplement plans available in your area. Again, start this process early so you're not rushing at the end of the annual enrollment period. Tip number 3, should you experience loss of coverage, the most common time to change is during the annual open enrollment period, which runs from October 15th through December 7th. You also have the Medicare Advantage enrollment period, which runs from January 1st to March 31st if you simply want to go from one Medicare Advantage plan to another. So if you've lost your plan and want to stay with a Medicare Advantage plan, make a list of your medical providers, hospitals, your prescription names, and the prescription spelling and dosage. That way, when you go to compare plans, you'll have the most information that pertains to your individual situation to make sure that another company will cover all of your providers and network and cover your needed prescriptions on their formulary list. Now, there is a silver lining opportunity in all of this chaos. If you lose your plan and want to switch to a Medicare supplement plan, because your Advantage plan will not renew, you will now have a guaranteed issue rights period, meaning you receive a period of time where you can avoid medical underwriting when applying for a new Medigap plan. If you've wanted a Medigap or Medicare supplement plan in the past but have been unable to get one due to medical reasons, you now have a period where you can do that with no medical questions asked. So again, don't take this guaranteed issue right lightly. Medicare Advantage plans require prior authorizations, and now you're seeing that the government reimbursement rate can take that plan away from you. That is all quite the opposite on a Medigap plan. Yes, they're higher cost per month. You will never deal with these government reimbursement problems. You will never deal with a provider dispute between a Medicare Advantage company and a provider. Medigap plans do not engage in those agreements. They simply fill in the gaps and pay everything that original Medicare does not cover. Medigap plans also do not have prior authorizations. I cannot emphasize to you enough the importance of that. All Medicare Advantage plans have prior authorizations, meaning the company has the right to approve or deny medical care on your behalf on Medicare Advantage. Medigap plans completely bypass that prior authorization process, and the benefits are fixed for life. Keep an eye on your mail, see what's happening to you personally, be prepared, know your options, and decide what to do. If you should have any questions, comment below, call us directly, and we would be happy to help you understand these changes for yourself and let you know if you get your letter, we can read through it and tell you if there's anything you need to do or you don't need to do. We can also help analyze other companies to determine if you need a replacement, which one would be the most suitable. Hope I didn't overwhelm you. Thanks for watching.